Hey everyone, I'm so glad you could all join us today for our lightning talks for December. Let me go ahead and share my screen. So hi, it's so great to see you all. My name is Madison Bradford. I'm a data scientist for the town of Gilbert's Office of Economic Development, and I'm also a member of the Professional Development Committee here with Women in GIS. Today is our first Friday Lightning Talks for December. Our topic is public health, and we have some really great speakers today. So as a reminder, our Lightning Talks are open to everyone. Just because we're a Women in GIS organization does not mean we do not allow all genders. We have an international community, so people from all over the world can come and present if they wish every first Friday of the month. So we'll have, a new topic for January. But this topic today will be public health. So I want to give a little bit of a thanks to our platinum sponsors. Women in GIS would not be able to host these lightning talks or have our events and activities funded without our amazing sponsors. Our platinum sponsors are Esri, Bad Elf, and Embedded Alliance. So we just want to give them a shout out for making sure that we can keep doing what we're doing to help empower women in GIS. We have a whole bunch of sponsors, not just our platinum sponsors. So I also want to give them a shout out for helping support our activities. We really rely on our sponsors to help fund, bring in speakers, fund workshops and things. So we just always have to give them a shout out, and we really appreciate the time they take to keep supporting us year after year. So today's presenters, we'll start off with Dr. Seema Mehra Parihar. She'll be giving a topic on visualizing trauma healing spaces for women in India with some geo insight. Our speaker today, Brooke Hatcher, I don't think she'll be joining us, but she was going to talk about dashboards for predictive risk and monitoring of disease. And our final speaker will be Chayanika Devi, who will talk a little bit about her work unlocking the potential of telehealth in Africa for HIV, opportunities, challenges, and pathways to equitable healthcare delivery. So I think we should go ahead and get started. All of this is being recorded. With our first speaker, Dr. Seema Parihar. I'm going to give a little bit of a bio before you begin. So Dr. Seema is a professor at the University of Delhi. She has around more than 35 years of experience in academics in the specific area of GIS, remote sensing, natural resource management, gender, and field-based research. Dr. Parihar has also been a trainer of trainer and a resource person for the national workshops on the capacity building of women leaders in higher education. She's become a visiting scholar at Le Havre University, Normandy, France, and taught natural resource management to students and was engaged in research activities related to gender studies. She has also been a principal investigator and project director of various projects, including women-related projects like the Gender Atlas of India, a geospatial in perspective, and Gender Atlas of India, a thematic perspective, sanctioned by the Ministry of Women and Child Development, GOI. She also has a project entitled Mapping Geospatial Dimensions of Hydropolitics in Jammu and Kashmir, sanctioned by the ICSSR. The project entitled Women Empowerment Atlas of India, Science and Technology Perspective, sanctioned by the Department of Science and Technology, GOI, and Mapping Good Practices of Institutions for Supporting Redressal of Violence Against Women in India, sanctioned by the World Health Organization. She has authored more than 40 articles in research journals and published 8 books, including her recent publication, Physical Geography and Diagrams with R.B. Bunnett. So I'm very proud to introduce Dr. Seema Parihar.
Thank you very much. May I share? Thank you very much. May I share my screen?
Yes, go ahead. You may begin.
I'm going to speak today on a topic which is very close to my heart. I'm trying to share my screen. What has happened?
It is already shared, ma'am. You have to just open your presentation.
PowerPoint.
Yeah, PowerPoint. Yeah. Yes.
Is it okay?
Yes, yes, absolutely.
All right.
Looks great.
I am today going to speak on visualizing trauma healing spaces for women in India and some geo insights. And of course, the key words that I'm going to speak today and share with you are my favorite word, which I always say whenever we speak about the violence and all that. Rather than speaking that, we speak on healers, healing spaces, and violence against women and girls redressal institutions. And at the outset, I'd like to acknowledge my WHO project, which is mapping good practices of institutions supporting redressal of violence against women in India. And also my own experience as a trainer of Ministry of Health, Family Welfare, where I train doctors on preventing injuries and violence. And of course, data collected for safety and support theme in my Women Empowerment Atlas. And this is a respect program, which again, where we address the related issues. Context is totally India specific and dealing with healing spaces, whether they are actually providing healing to many women or not. Objective, when I say of this paper, is about healers of different kinds who sanitize the spaces of trauma, and to also introduce the concept of geo healers and contextualize geo trauma healing system or network of women in India, and to assess the preparedness of geo healers and geo trauma healing spaces in India, and to identify and document good institutional practices that support redressal against women and heal women, and to collate and bring back insights from on-ground actions to inform and later collate the priorities for strengthening geo-trauma healing spaces for women in India. I'm very happy that when I started doing this project, that actually they exist. And when I contextualize geo-trauma or geo-healer and geo-trauma healing spaces for women in India, reasons are quite simple. Problem exists. It's a UN data. It's not my data or yours data. 1 in 3 women are the ones they've experienced physical or spousal or sexual violence. Besides that, what we find is 37% women experience intimate partner violence in least developed countries. And 15 million adolescent girls worldwide have experienced forces. 1 in every 4 adolescent girl experiences physical or intimate sexual violence, and not more than 40% seek help. And go on and on and on. If you go on, then that means there is a problem that exists. And this problem definitely needs solution nearby where you are living or wherever this problem occurs. And of course, at the same time, implementation decade as sustainable development goals are having a lot of issues, but still, present paper also targets elimination of all forms of violence against women and girls. That is the target 5.2. Another on ending abuse, exploitation, trafficking, and forms of violence against and torture of children. And government and multilateral agencies, we all realize they need scientific evidence. So this paper is where I've collected data. And this paper, I started off, this research, I started off when the COVID was there. So we got introduced to a lot of new ways of collecting data, and which we followed it also. And we have very genuine feedback, and then we again followed it. The word trauma, when I talk about it, this word trauma, what is a big word? It comes from the Greek, and according to it, it contains a double reference to a wound. And any traumatic event can, what I feel, can be divided into 2 types. One is a single or type 1 if it happens occasionally, and repeated or type 2 if it is cumulative. In your hearts of hearts, we are not having lot many audience here, but at the same time, I would like to say that yes, if you address a large gathering also, one or the other women, you will come across who have suffered violence of whether an occasional type or a trauma of accumulative time in recent past also. Whether all of them will speak about their issue or their concern is a big question mark. And the whole idea is to express today to you all young people, the ones who are here, that's even today, it's not only the gender disaggregate data is missing, but it's also data related to trauma related to women also is somewhere along the line. Different variables are still not mapped. And research and data analysis have definitely told us about it. I like Rachel Payne's definition of trauma or geotrauma. She uses the term as a framing for spatial analysis, diverse forms of trauma. It rests on the core tenet of psychoanalysis theory that trauma is animated externally and internally in a relationship with the other that is both topographically and topological. So there has to be an other, and this trauma comes from the external pain or from somebody who is penetrated deep inside your heart or head. And also it's internally. How strong we are is something that, of course, is an issue. This paper is slightly different than all that we have seen, is of course that we're talking about geo-trauma. At the same time, we're also talking about geo-healers. My paper is on geo-healers rather than on trauma. Trauma is there, but we definitely need places of healing. That is important. And data, this is different data, NFHS data, which is just quite recently published. It also talks about spousal violence. But a good point is that if you look at the graph, which is there, that in many places, spousal violence in some regions is decreasing also. That means if there was 30% or 20%, so today you're having many places where it is decreasing also. This graph is going down. But at the same time, you have cases of sexual violence, you have cases of physical violence, you have cases of psychological violence, and so on and so forth. Because of the paucity of time, I cannot go to each case, but out here, there are many documentaries also which I've prepared as a part of the project, and you find that there are many unheard voices. Of course, there are very few people who are very open about when it comes to the pain given by their partner who is close by. And so this is, of course, an issue which we all need to address. So therefore, the present paper is on mapping the one-stop centers, which are state-driven supporting spaces for violence against women and girls. We have family counseling centers and we have special centers. So all this is the field work which I've done and have been part of. And in case if you look at here, you find that this woman, because she complained to the police, if you look at this cartoon, this boy is again providing pain to her, but she's happy that today we have some institutions which have come to her rescue. I take pride in sharing with you. In India, we have 699 one-stop centers, which are called, with the name also Saheli sometimes. Saheli is friend. Family counseling centers, we have 661. Special cells, we have 522. And total, we have 1,882 institutional supporting system for women. But the key question is not of having them all alone, where to have them and what to have them, and whether they are helping women or not. And so we evolved a questionnaire and to collect data. And that's something what we've done. And there were some digital questionnaires, there were one-to-one questionnaires, and there were a lot of special trained working group that helped me in collecting data. We also had set the criteria framework for documenting good institutional practices to support redressal of violence against women in India. This criterion framework, when we were planning, it was an expert team of 28 smart women who were sensitive that there exists trauma. And so we evolved a scorecard tool also. And if you look at it out here, you find that, all this has been mapped in different zones of India. And in case if you look at it, worse out here is this particular zone, which is Gujarat and this Western belt, where you find that, when we look in the scorecard, here we have, so right now, I'm not going to depth where it is more or where it is less, but one thing that is sure is that there is a diversity in different zones. So then that means all different zones of India need different redressal mechanism to come closer and solving the issues. And so there were different regions, different scorecards, different value was given to each particular place. And some were greater than 60%, some were greater than 60, 90, 70. But largely, we found with this data that we can definitely spot on that where to have, what spate is having how much impact on the student's mind or the young girl's mind or women's mind, and whether they are also going and finding some healing support from these. Learnings from the study is certainly one. Certainly, of course, many, but one of them is that external support helps in building healing spaces. This page is from my Empowerment Atlas of India, where we find that, government is there to support. We have 31.56 crores of records where it is showing that women have gone there and have taken a support, 13,295 number of persons who have been trained in handling cyber crimes against women, and they call the cyber dose. So similarly, so we have different cases there. We have 1 million another downloads where they've downloaded the apps for the safety, and in different cities it's there. So, and we have 701 functional one-stop centers. And we looked at it, so that's a great number because India is diverse and these are functional one-stop centers. And I can tell you with my own database, which I have collected, interacted, have visited all zones of India, that these are actually providing support to a lot of women. And we all need to remember that there are different shades of violence for women. And I always say at the forms, and I always say the acronym that we need to remember is PENS, PEN that we all have and which we all use. Physical violence is there, psychological violence, emotional violence, neglect, economic violence, sexual violence, and so on. And so I mapped how many, where, and whatnot. At home, relationships, school, community, online, and so on. So all these things are there, and worse of this kind, many of them have said, is neglect. There's a smart way of this thing. So we all definitely need to create a sensitive community today who holds a healing lens for the following symptoms in any woman, whether they're in depressed mood or substance abuse, eating, sleeping, uncontrollable anger. These are different categories which we have created and we've collected data on. But my request to, again, each one who is listening to me or would listen, that, even in a neighborhood, there may be a woman who's my friend or who's known to me or who's somebody's friend. In case if she is having or suffering from social withdrawal or a suicidal or self-harm tendencies, we definitely need to hug her and give her a support. And what this research has also shown that geography matters in locating geo-trauma healing spaces in India. What I mean by geography matters is that in case if the different spaces, for me, accessibility was also one criteria, location was another criteria. So this research has shown that the most preferred location are those one-stop centers that are located within the hospital. It's not initially, I also thought that maybe that place which is somewhere in the isolation would be a great help. But all those one-stop centers that are located within the hospital premises with the ready availability of redressal services existing in the hospital were definitely preferred by most women who suffered. Because there was no stigma attached going to a hospital. It could be for any reasons. And the institutes that have maintained self-sufficiency in terms of availability of redressal services are working more efficiently as compared to those that refer the cases outside the institute. And that's what the case is. And also geography matters in locating the trauma because number of women reaching to one-stop centers for help as compared to those who are not having these facilities. And what I mean by these facilities are those facilities where this trauma centers can be easily located on Google Maps, or there was a sign that here this is one-stop center. So visibility also was one criteria where women reached more. And I used this theory of change which I had constructed, and I found that there are ways in which we can help. There are ways which these spaces can provide healing and hugging facility, provided we are sensitive to it. So for different region, we need to have case-to-case suggestion, good book, record book, and a solution. And that's something which is so very important, and we need to work towards it. And I can only say that, no, this is not the end. I don't know where it is happening. So what is there to learn from us is, yes, in the end, I can only say that spaces of trauma convey different imprints and pain for women occupying different geographies across scale and time. And when I say scale and time, it's not necessary that Asian communities are like this or this is that. The different scales and layers attached to it. Healers in their varied forms occupy a most coveted position in the spaces of trauma, violence, suffering, distress, neglect, and injuries that women experience and generate positivity. So for me, if we have spaces of violence, we also have spaces of healing, provided I'm ready to go and seek help. Healing spaces of trauma need to be expanded, and we need to create places of healing. Policy framework need to be prepared based on mapping at least 4 good practices of each region and designing national level healers program around it. There is a need of a national program to be evolved with 4-tier structure and of course financial support. One are geo home healers who lives in your inner core, geo community healers, geo national healers, and geo global healers. Specific interdisciplinary healer capacity building program are to be launched with regional manuals and case studies that I'm undertaking at present. In one of them, Swati is also involved with me. So for me, in the end, I only would like to say research confirmed 3 findings. One, that trained healers can heal and lessen the sufferings of women from spaces of trauma. So the key word out here is trained and sensitive. 2, that the knowledge of local geography expands the healing process and help in converting the spaces of trauma to spaces of wellness. Local knowledge definitely helps because understanding is much more stronger. And 3rd, that institutional support in a structured format expedites the process of healing. And that's something which is definitely there. And that's something which is definitely there. So in the end, I only would like to say that let's all join hands in solving the issue. Let's all join hands in creating places which provide healing and not pain. And in a diverse country like India, geography matters in the end. Thank you.
Wow, thank you so much, Professor Seema. That's a beautiful call to action. The work you're doing is really vital to the public health of women and girls in India. And I'm really so glad that you were able to share your work with us and really put some light on this super complex issue. Your work, it's going to be amazing, the positive impact your work will have on the future safety and healing of women and girls in India. Thank you so much for sharing.
Thank you. So can I stop sharing now?
Yes, you can.
Thank
you so much. So any questions we have for Professor Seema, we're going to save until the end. So just make sure that if you have any questions, you can drop them in the chat or you can ask live at the end of all the lightning talks. Thank you so much again. That was really, it's such a hard topic
I would only like
talk
to
about.
add, with your permission, I would only like to say, if any time any person would like to collate, right now we are going to engage in another project which has been sanctioned recently by Ministry on capacity building program for women healing, women safety, women empowerment. Please join hands with me and my project and we all can work together and make this place safe, sound, and empowered for women, not only in GIS, but women are something which are even today missing in 2023 or 2024. We are there at the bottom. Let's pave way to be at the top. Thank you.
Thank you so much again, Professor Seema. That's amazing. It's really, really beautiful message of togetherness. So thank you so much. We have one more presenter for today, Chayanika Devi. She'll be talking a little bit about unlocking the potential of telehealth in Africa for HIV, opportunities, challenges, and pathways to equitable healthcare delivery. So I have a little bio for you, Chayanika, before you begin. So a little bit about Chayanika. She is a PhD student in the Digital Epidemiology Laboratory at the University of Cincinnati, Ohio. Prior to this, she completed her bachelor's in computer application and master's in geoinformatics in India. Her research focuses on global health and data analysis and data visualization. With a focus on data analysis and visualization, her research is centered on enhancing healthcare outcomes in African countries, specifically Kenya, Uganda, and Zambia. Currently, her work delves into unlocking the potential of telehealth for HIV in Africa, aiming to identify opportunities, address challenges, and pave the way for equitable healthcare delivery in the region. Thank you so much for joining us today, Chayanika Devi. You
Yes,
may start sharing and begin.
thank you so much for the introduction. So I'm going to share my screen now. Yep. Is it okay? Okay. Is it visible, right? Yeah.
It's visible, but we can see the notes side.
Okay. Sorry. I okay. I don't know why it's just give me
Chayanika, go to the display settings, please. On the top. No.
sorry, just display settings. Okay.
When you put it on the slide mode, you can see the display settings on the top.
Oh, display
Yeah,
setting. Okay.
on the top. Just
On the
go there. Go on the top,
okay,
top of your
more.
presentation.
Uh,
There is an option, display settings and end slideshow. Just go to the display settings.
okay, yeah, perfect. Okay,
Yeah.
display slideshow. Okay, yeah.
Yeah, just,
Okay.
okay.
Now it's perfect.
Yes.
Yeah. Okay. Sorry.
No problem.
Hello everyone. Today I'm going to talk about in telehealth in Africa for HIV, opportunities, challenges, and pathways to equitable healthcare delivery. This is a bit of opinion-related paper, which is going to be accepted, already is accepted for my journal. However, is going to publish within 2 and 4 months probably. So here is the outline of my presentation today. First, I'm going to talk about some background information, then introduction and data I have used in this study, methodology and results, and lastly, conclusions and discussion. So background of the topic is, first, I want to talk about what's the healthcare access. Healthcare access is the ability to obtain healthcare services such as prevention, diagnosis, management of diseases, illness, disorders, and other health impacting conditions. However, many people, they don't have access to adequate healthcare. It could be the reasons for economic infrastructure, lack of physician, and there is shortage of insurance. So it could be the so many reasons for why they don't have the access to adequate healthcare. Even while having access to healthcare is important, many people and communities are still face significant barriers to getting high quality care. For example, the people live in urban areas, they get high accessibility cares. They don't have much to they don't have much barrier to getting the proper care on time. However, the rural people or underserved communities are still facing those barriers to getting the proper healthcare accessibility. So this map shows the healthcare access and quality index from 2015. So here, this maps, you can see the dark blue color indicates that have a higher healthcare access and quality index as compared to sub-Saharan Africa. They have still are behind to get healthcare access and quality. Also in South Asian countries has also the same significant barriers while coming to healthcare access and getting the quality of care. There are so many factors, again, the socioeconomic factors, gender disparities, geographical disparities, lack of physician and healthcare providers, also insurance, that could be the reasons that which hinders getting the healthcare access and quality index. So this healthcare accessibility could be maximized if there is a proper health equity. So what's the health equity? The attainment of the highest level of health for all people, where everyone has a fair and opportunity to attain their optimal health in regardless race, ethnicity, disability, sexual orientation, gender identity, socioeconomic status, geography, preferred language, and other factors that affect access to care and health. So this health equity probably could be maximized if there all the places, it's urban and rural communities, they get to more healthcare accessibility on time 24/7, and this could be helpful the services like telehealth, mHealth, to the digital health technologies. We have seen the during pandemic and after the post-pandemic, people have access to more digital health technologies to use this, the getting better healthcare accessibility. However, there is a significant barriers which the people are not getting who lives in remote areas. So healthcare in Africa, Africa has a major challenges in terms of healthcare accessibility. HIV is the epicenter in Africa, and this tackling with HIV epidemic is a major issue so far. Getting timely diagnosed, treatment, and other health-related issues are important to minimize this epidemic, which is still it's a problem in Africa. This could be possible to implement if access to healthcare that every individual should have, such as digital technology, telehealth, or telemedicine. In particular, the implementation of telehealth in low-income settings. Sub-Saharan Africa countries, they need lots of exploration to get connectivity and availability of digital technologies and the digital literacy. If this could be implemented, then doctors and health providers can reach more patients in a more flexible ways. They no need to travel any distance healthcare centers. They can easily get to accessibility when they are at home or any other places. However, there is a long way to go, and technology is developing and expanding in a slow rates in the rural areas of Africa. So these two maps shows the private and public health expenditure from the 2019. So here you can see there's in terms of private health expenditure, these places have still low. It's compared to the some places in Eastern to Africa, they have still very low. And also you can see the capital city of South Africa, they have still their they have expenditure in 2019. However, it's not to equal to if you see the geographically. So now this HIV prevalence in 2022. So here you can see this mostly the South Africa and then to some countries from Eastern Africa, they have a higher prevalence for HIV, which is more than 30%. And this HIV prevalence it's a marginal, also it's increasing to probably there could be reasons for that as I mentioned, and socioeconomic factors, gender disparities, getting proper healthcare services and accessibility, less of physician stories. So this could be the possible if telehealth telemedicine could be implemented those areas like Southern and Eastern Africa. So what's this telehealth? Telehealth refers to the utilizations of digital technology to provide healthcare services remotely. So these telehealth services can be delivered through different technologies such as store and forward. You can capture the image and then you can send to different locations. Remote monitoring, so 24/7 to any clinician, healthcare providers, they can consult with your about your health status. It could be also mental health, and the people who have stigma for HIV, like they don't want to go and they don't know when they have that HIV, so they can also get that remote monitoring and real-time interactive services. So these telehealth services are proposed as key elements to reduce healthcare disparities in Africa. However, the barriers that vulnerable communities in Africa are still facing to accessing these digital services are not fully understandable, although there is a lots of resources are going on and implementations of telehealth and mHealth is still on process to set up this project. Therefore, it is important to identify those potential barriers before the expansion of these digital healthcare services. So what could be the determinants of health? So first is digital determinants of health. What are the barriers and challenges for the successful implementation and expansion of digital healthcare technologies? There are technical requirements to get adequate access digital health services, which include connectivity, the availability of a stable internet connection to support digital healthcare services. If there is a stable broadband connection or landline connection, there could be more healthcare accessibility. Access to digital devices, the availability and accessibility of smartphones, computers, and tablets then can support digital healthcare services. Again, if there is a more available of digital to gadgets like smartphone and computers, then the people will be in the equality of access to digital healthcare services. Thirdly, the digital literacy. The knowledge and skills are really important to get user-friendly with the apps. So it is important to use the digital healthcare services before they accessing to digital devices. Also, this map shows the number of people using the internet 2022, 2012, and 2016. So it's gradually expanding, where you can see in 2020, a few countries from less number of people using the internet, but however is increasing from 22 to 2016, and then you can see that in 2020 is in southern part of Africa as well as eastern part of Africa has increased. And why this internet is important? Because we need to do video calls if we have to get to telehealth or mHealth services, because the videos calls necessary for the doctor and patients to talk to each other. So we need to be connected to a fast internet network to use the telehealth services. So the objective of my research study is to conduct data visualization and spatial mapping to explore the potential role of telehealth in Africa, particularly in tackling the HIV epidemic. So data I have used from Demographic and Health Survey. Demographic Health Survey is a nationally representative household survey that provides essential data on a health and population characteristics of a country's residents. It also aims to advance global understanding of health and population trends in developing countries like Sub-Saharan Africa and South Asian countries. It also provides data for communication and living conditions of the region's population. So we use data from internet users among men and women from 2015 to 2020. So the first results I'm going to explain it to you. So the first maps shows the percentages of individuals that use internet at least once in a week for women. So here you can see the Pretoria. This is a capital city of Africa. They have a more number of internet users among women. Again, the Zambia, this part too, they have a the ratio is higher, same as in Tanzania and Kenya, whereas the male have actually higher ratio of using the internet to at least once a week. So Kenya, there are higher percentage of internet users among men. Again, the Tanzania, these all are the capital cities. Then Zambia and the Pretoria in South Africa. The reason behind that, probably the male actually they go for jobs, they work in technologies companies, so they don't have much problem with using the using the apps like they can do. And whereas the women mostly they used to stay indoor, and so they didn't have much knowledge about the apps where they, so they don't have the proper accessibility of the internet knowledge. Then this second result shows the percentage of individual, the heart of HIV for women. This is very interesting actually. This women have a very they have they do there's this heart of HIV. It's very in rural areas in Africa have very higher as compared to the capital cities of Pretoria and then Tanzania. These capital cities, they have a very they heard about HIV, whereas the men have actually more percentage of hearing this what's kind of HIV awareness and education. So male have a very higher proportions of hearing about HIV word compared to female. Again, this map shows the individual with no access to media for women. So women have actually, they don't very less percentage of access to media like social media and news articles. So access they have very less compared to men. And these are the conclusion of my study. Kenya, South Africa, and Zambia showed high internet user, more than 45%, and reflecting more developed infrastructure and economy relative to the other countries. However, nations like Malawi, Uganda, Zimbabwe have comparatively lower rates, less than 20%, is really indicating the challenges for using the internet accessibility. For males, regions such as Kenya, South Africa, and certain parts of Tanzania, Zambia, they show a higher concentrations of internet users, more than 45%, whereas females generally exhibit a lower internet users rates, while regions like Nairobi in Kenya and Pretoria in South Africa, those are the capital cities actually, and they have a actually higher percentage of accessibility among females in Sub-Saharan Africa. So the discussion of my study is the effective delivery of HIV services through telehealth. It requires healthcare providers to receive adequate training in telehealth technologies and virtual counseling skills. It also emphasizes the need to consider socioeconomic factors and the digital divide in low connectivity regions. The more implementing costing of the public and private health expenditure and socioeconomic, the low socioeconomic barriers, then it's a more implement in the digital divide. The importance of addressing barriers such as financial constraint and privacy concerns, technological challenges to ensure to successful implementation like digital health technologies, which is mHealth in Kenya and Pretoria. So these are the references for my study. You can go through it. And yes, thank you. And I would like to take any questions that you have.
Thank you so much, Chayanika. That's another super important topic for public health. I love that both of these topics were so like difficult and complex. I really think that it's really important that people teach other people about these topics, and you can really learn a lot just from a lightning talk about a different
Yes.
issue.
Yes.
It's really amazing the potential that telehealth has to completely
Yes.
change the game for healthcare in Africa and eliminate those barriers to health equity.
Yes,
Wow.
and I actually am planning to go in 2024 probably for data like on ground data collection, because we are not getting, like, I need a very small scale also data collection, but there is a lots of challenges. However, I'm going for data, then I have actually very visual and brief idea about that on ground, what actually is going on over there. So I have to collect for like sex workers data and like travel distances data and also, which I am not able to present at the time. Yes.
Wow. Well, good luck with all your future
Thank
data
you.
collection. That's so important what you're doing. I'm
Yes.
really glad that you
Yeah,
shared that with us.
yes. Thank you. Yeah.
So now is the time for questions. So if anyone has any questions, they can either put them in chat or unmute themselves and ask.
Yes, can I ask one question from you?
Yes.
My just one prime question to you is, how, according to you as a young girl, how much do you feel that people around living in homes who are less educated are sensitive to the issue?
Uh,
Or it's an academic exercise?
Sorry, I can you little bit clear about the question? Actually, Dr. Seema, if
Yes,
you.
my question is, do you think people around are sensitive and there's a supporting system that's provided to them
Actually, that's a very
from the
good
state?
question. Yes, it's a very good question. Actually, in South Africa, what is happening, like on ground, like some people are still there, are very, they're ready to adopt this challenge, implementation, like whatever the digital technology they want to access it. But again, some people are still, they have some cultural beliefs and like they are. They have some stigma to, like they don't want to means use all those things, and like something there they have pressure and something I'm not sure about it. But however, some areas in urban people, actually we have getting the more positive responses compared to the rural people in sub-Saharan Africa.
Thank you.
Well, I don't see any questions in chat, so I have a question for Dr. Seema. So my question to you is, what do you think, what kind of innovative approaches or strategies do you see being crucial in further enhancing and expanding access to healing spaces for women across India?
First and foremost, for me, is acceptance of the fact that in case if the violence comes from the closer one, it's an act of violence, and that needs attention. First of all, is the inner acceptability that there exists that. And then, of course, one of the biggest strategy for the healing that I foresee is state support is there in terms of money and this thing, but accessibility is even today missing. We need different models towards it. Two I've evolved and I'll be taking it forward. But definitely what is required is accessibility. And in case if the accessibility of that healing support is there, because for me, you'd be surprised. What is worrisome is NCRB data. NCRB is a government agency which is collecting data on crime against women. What is definitely, traumatizing experience, just to look at the data, is that 98.7% of the cases are where all this form of violence occurs are from those people who are very close to them. Their fathers, their brothers, their uncles, they're different people who live inside the home. So we need a mechanism of sensitivity that there is a need for healing. But for me, rather than, always talking about violence, we also need to talk about healing. And, in India, you'll be surprised, which I'm guiding another MPhil, is that healing also come in India, which I've not touched out here because of the WHO project, also comes from the spiritual ways in India. Say, for example, we have Bhagavad Gita and different books and all that. And we also have small temples in almost all homes, temples of different kind. There can be a temple, temple is that place where people bow their heads and feel that, God will heal them. And that also subconsciously give a lot of peace. So at the outset, one, I would say we need to redefine the need for healing. We need to redefine need for healers. We need to find close solutions inside homes or in the neighborhood community, which will provide help and remove something called stigma and convert that stigma healing spaces to healing. Let us start telling people that there is a place for healing which is free in terms of financial, and there are those supporting mechanisms. And I'm happy that we have those supporting mechanisms in India, but there's less awareness about them. And so we definitely need to work towards it, because even UN data says that world over, 1 in 3 women are the ones who are suffering. And rape capital is not in India. Rape capital of the world, we all know, is in maybe your part of the world, where so we need definitely to provide a mechanism which is regularized, accepted, and provide healing. And of course, at the same time, that one word starting with C called confidentiality, we need to have in that particular space. One-stop centers are being used, but only 13.3% one-stop centers out of those 761 centers which are working are being used. The rest all time in infrastructure and all that is people are not even aware, or people are not going there. So awareness programs, acceptability, sensitivity towards the need, and providing or cajoling people to go and report and go for the support, for me, is something which is a need for the day. Thank you.
Thank you so much, Professor Seema. It's really amazing. And I love how you keep saying sensitivity is such a key part of that. I feel like that's not always talked about, how it really matters psychologically, how people view things. And I really love how you talked about the little places and communities that people can go to sort of prey on things, or to think about, that they're just to get that help that they need. It's really, really amazing. Thank you. So if no one else has any questions, I have one more question for Chayanika before we wrap up today.
Sure.
So yeah, I have a question about the future of telehealth. So how do you envision the future of telehealth evolving in African countries, considering technological infrastructure and the changing healthcare landscapes? Like, how do you think something like this could be implemented on the ground?
Yeah, that's a very interesting question. Thank you for this. And I think so. It could be possible if as in real on ground. If now I don't know, because I don't have any perfect because I haven't gone for any data collection thing. However, from my knowledge, what I have got to read, that some community engagement, like people over there in search education, if they will try to keep some this education like digital literacy program, and like whoever goes to school, their children, they can help to parents to at least the helping with the user friendly apps and all, then it could be possible to expanding this digital literacy knowledge. First of all, for the for telehealth or health services, we need that digital literacy. As you know, like my parents, if I give example, they get also sometimes annoyed with that using these apps and all. However, so those could be possible if the everyone have to be agreed, but again, it's a very difficult challenging task to make it in real. However, we can implement, like there is a search program for HIV awareness prevention, and they have a treatment which is called ART. So those people, before getting to HIV, they don't aware of that too. So this kind of implementation program could be helpful only through the digital health technologies in future. And again, there is needs stable connectivity broadband, which is it's a way behind. There is still is progressing, like only capital cities, they are implementing this internet connectivity. However, it's at least it's very low. As I showed you, the number of person using internet is very less. However, I'm hopeful that like in Kenya, this health program it's really, they are working in hard to making it on ground, and they are actually doing it well. But the response from remote and underserved communities are still is below like 10%. So those people, we have to make like size kind of outreach community programs, so that could be helpful for in future. So I believe that way. Yeah.
Wow, thank you so much. It's really amazing how both of y'all's topics really have such a focus on awareness as like a major strategy. And it's really amazing how much awareness of an issue can actually sort of improve outcomes of an issue, just even knowing it exists. So I think what y'all both are working on in relation to getting people to know this issue exists, and to know the first steps to address it, and where they can go, where they can get help, whether that's telehealth for one stops. Like, it's really amazing that y'all are trying to raise this awareness, and you guys are doing this research. Thank you so much for joining us today. I'm really, really happy that y'all were able to take time out of your days and in the middle of your night to share your talks and your research. Just thank you so much. This is going to be recorded. This will be published very soon onto our YouTube channel, so you can share with your friends and family. Please, viewers today, I hope you go and share this video as well, because these are the most important thing about these topics is awareness, especially when it comes to public health. So I really hope that y'all enjoyed today, and that you would, return next month for our next Lightning Talk series for January. We're kicking off the new year with climate change is our first topic. So submit a talk, attend a talk. Anyone can submit, of any gender. And of course, we're an international community, and we really appreciate everyone coming out today and supporting women in GIS, supporting public health. Thank you all so much for attending.
Thank you.
Thank you very much.
Yeah,
Okay, enjoyed it too. Bye.
yeah. Thank you.
you.
Bye.
Yeah. Bye. Yeah.